Hello, everybody. My name is Gold, and today I'm very happy and honored to be here to present to you a very widespread virus, which is the Ebola virus breakthrough. And now I'm going to divide my presentation into four main parts. Part one is the overall concepts. Part two, the patients and symptoms. Part three, prognosis and diagnosis. And eventually, we are going to investigate the treatment and prevention. And now, let's start with the very first parts, the overall concepts. So as you can see, this Ebola virus disease, which is also shortened as EBD, is a viral disease which is caused by the Ebola virus. It belongs to the Firoviridae family. And this is the overall structure of this virus. It possesses a thread-like shape which can be changed into a circular or filamentous. And this disease began in Central Africa in 1976. And now let's move to the part two, some patients and symptoms. So please remember that this widespread disease can be affected to a wide variety of people, regardless of ages, genders, and races. And there are also multiple ways through infection, for example, tears, sweats, bloods, milk, urine, or even vomiting. And it occurs mainly in sub-Saharan Africa, and especially for those who are immunocompromised, they're much more vulnerable. For example, if you have to suffer from HIV, then this case would be much more dangerous for you. And besides, also as for other species like chimpanzees, gorillas, or monkeys can also be detected. And these are the five main symptoms: headache, muscle pain, fever, diarrhea, and vomiting. Now, the symptoms are absolutely acute because it's also even happened in just from 2 to 21 days, which means that after this period of time, you can experience death. And now let's come to part three, prognosis and diagnosis. As for the EVD effects, only some people will get better without the long term effects. As for the EVD survivors, they can experience the post Ebola syndrome, which can be experienced about just several months later. As for the severe cases, you can experience various bleeding, organ failure, shock, and secondary infections. The most dangerous case of all, fatality. And on average, the case fatality rates can be approximately 50%. It can also vary from destinations to destinations, so it can be from 25% to 90% in all places. And these are the four most significant diagnoses. The first one would be the PCR test, the antigen detection test, the antibody detection test, and final one would be the virus isolation. And now let's come to the final parts, the treatment and prevention. Unfortunately, there is no specific treatment during that time. However, you can also apply some of these following treatments in order to get better. The first one would be the electrolyte and fluid replacement. Oxygen therapy and antibiotics may also be needed. Please avoid socializing as the very first prioritize in prevention. Eat hot food, drink broad water, wear protective clothing, and get vaccinated. And that is the end of my presentation. Thank you very much for your attention.